Greetings and welcome to this YouTube channel. It is Chaplaincy Awareness. The channel is about creating awareness of healthcare chaplains in hospitals and hospices, prisons and so forth. You know, while several people have heard about chaplaincy, many more have not. They've not heard about chaplains. They've not have any experience with chaplains yet. So this channel is to create such awareness for chaplains, for people who are in the hospitals, awareness for the patients' family members, awareness for medical staff, to let them know, help them understand the work and the role of healthcare chaplains. Now, when it comes to the history of chaplaincy, depending on who you ask and what research is done, you will find various aspects of the history of chaplaincy or histories. Some histories of chaplaincy will take you to the New Testament time, and some will take you to 12th century Rome and so forth. It was some years ago when I decided to become a chaplain. My wife and I, we talked about it, and then I said, okay, I'm going to be a chaplain. After speaking to a couple of minister friends of mine who were chaplains and who also helped other people become chaplains, they told me that I needed to have a master in theology. I only had an AA at that time. I enrolled into a Christian college and earned a bachelor in psychology. After earning the bachelor in psychology, I enrolled into another school, a Christian school, and that's where I registered for master in theology. After doing the psychology, I forgot all about the chaplaincy. And so I did the master in theology. However, toward the end of completing the MTH, master in theology, I thought of going for the doctorate. That's when they told me my GPA was too low to go for the doctorate. If I wanted to go for the doctorate, I would have to have an MDiv. And so an MDiv I went for. This time, still, instead of chaplaincy, I did the MDiv in homiletics. Straightforward, I enrolled into the doctorate degree, this time in chaplaincy. However, in the midst, toward the middle of completing the doctorate degree in chaplaincy, I decided that I would pursue a career in healthcare chaplaincy. I discovered that to be a chaplain in the hospital, one needs to have CPE units. Clinical pastoral education for chaplains or spiritual caregivers. And as I am completing the doctorate degree, to acquire those CPE units, I had to simultaneously register into CPE or clinical pastoral education at one of the local hospitals. And so we'll talk more about how to become a chaplain, what is required. But this is just a little history of my journey of becoming a chaplain. Now, a chaplain provides spiritual and emotional care to patients, their family members, and medical staff. One of the primary tasks or primary ministries of a chaplain is what they call the ministry of presence. The chaplain is to be there with the patient or the family members or staff with a non-anxious presence. Some of the tasks of hospital chaplains or healthcare chaplains are, again, patient and family support counseling, grief counseling, pre-surgical and post-surgical counseling, crisis intervention, grief and bereavement, counseling, prayer, scripture and sacred reading. All that and more are part of the work of the healthcare chaplain. There are various types of chaplains. military chaplains, corporate chaplains, correctional chaplains, educational chaplains, and of course, healthcare chaplains, and more. The healthcare chaplain is a faith leader to those who can use their spiritual and emotional support in guidance and prayers. Healthcare chaplains serve people of all faith and denomination. I interviewed 5 healthcare chaplains. All of them said this one thing: to be a chaplain is a calling. We will hear from our interviewers as they explain to us what chaplaincy is about.
It is not easy, but the chaplain has to be mindful of the fact that, what you say, charity begins at home. In order for me to help somebody, I am to be in a position, to draw from my strength, from my spiritual life, in order to assist that person. So I would say that self-care is important. Now, you can do that by having a group of chaplain, being part of a group of chaplain. You can have meeting from time to time to share about, your experience, help each other, find a safe place to share, because that's what's lacking. And I would say that it's not just the chaplain, ministers in general has to have that system in place. And usually it's not.
As part of training, one of the big part of chaplain training is your personal health, because they will go into you so deep that things that were hidden in your life that you didn't know, they need to come forth. If you don't do that, this is what will happen. You need to take care of yourself as a chaplain. There is what they call the parallel in chaplaincy. If you don't take care of yourself, you won't be able to take care of other people.
Well, chaplains generally, for instance, the physical, we do not address physical needs of the patient, because we also have social workers that we work with. We are part of what they call an interdisciplinary group, where we have the doctor deals with, of course, the medication, the nurses deal with the medications, and other issues like that. And the psychosocial, of course, includes spiritual. We have the social worker for the emotional needs of the patient. That's our focus, spiritual and emotional. This is the focus.
But when it comes to institutions like a hospital, they generally require ordination, endorsement from your church body. If you're Episcopalian, you need to have endorsement from your bishop. If you're Lutheran, Methodist, you'd have an endorsement from your area coordinator or whatever. So each church has its own system, but you need to get an endorsement from your bishop. And then you need to have 4 units of clinical pastoral education. In most cases, if you're working for a hospice or a nursing home, they may require only 1 unit of CPE, clinical pastoral education. So it depends on the institution. Prisons have chaplains, and they also would have their own criteria, probably ordained, endorsed by, and they're judicatory and probably require some clinical pastoral education. So it really depends on the requirements of each institution.
When Jesus talked about his job description, he said, he came to heal the brokenhearted, to set the oppressed free. Sickness sometimes is like an oppression, especially if you have a long-standing chronic illness. People feel oppressed. You're restricted to certain things, you're limited to certain things. And so couched in his Luke 4:18 description, when he said what he is anointed to do or came to do, is some of those ministry of helps, I call it. And so you have to have a specific calling to be a chaplain, and you have to love people. You have to love people. I always say you cannot lead God's people if you can't love them. You have to have a heart for people.
This YouTube channel is a resource hub for healthcare chaplaincy. We encourage your comments. We encourage you to like this video and all the videos. Please subscribe to the channel. Click the notification bell so that you will receive new videos as we post them. Thank you so much for watching. Until next time, I am Roland F. St. Gerard. God bless you.